Well, measles is a viral illness. It can cause a mild illness, but sometimes it can be serious, including hospitalization and death. It can cause a neurological problem. It can come with long-term disability in some of the children who are affected. Looking at it nationwide, um, there have been about 12% hospitalization in children who have been infected, and there have been 2 deaths. So the consequences can range from mild illness to death. One case confirmed in Buck County. The best protection so far is still to get the vaccination, which comes in the form of measles, mumps, and rubella vaccination, or measles, mumps, rubella, and varicella vaccination combined. In fact, 96% of the cases nationwide have been in people who have not been vaccinated, or we don't know their vaccination status. And all the cases in North Dakota so far have been in people who have not been vaccinated. I think the first district is having a mobile unit in some of the areas close to where there's an outbreak, and I think it's been publicized. You don't need to make any reservation. Just show up if you don't know your vaccination status, or if you have not been vaccinated before, you can show up and get vaccinated. Yeah, but like I mentioned before, all the cases in North Dakota have been in people who have not been vaccinated. If you're vaccinated, you're protected. You don't have to worry about it. If you have family members who have not been vaccinated, this is the time, to encourage them to get vaccinated, because we know the vaccination works. There's more than 90%, protection from the vaccination. So. People who, if you don't know your vaccination status, or if you know that you've not been vaccinated, this is the time to do it. Don't wait until there's an outbreak or a community outbreak in your area before trying to get vaccinated, because even after vaccination, it may take up to 2 weeks to develop a full immunity to protect you against the virus. Yes, it is important for children and adults to get vaccinated, especially if you don't know your vaccination status, or if you know that you have not been vaccinated, because both children and adults can get sick from the measles, and sometimes you may be sicker if you're an adult and you don't have any immunity against the virus. So yes, if you're an adult and you know you've not been vaccinated, this is your chance, because the measles virus is highly transmissible. In fact, you don't have to have a close contact with a case in order to get the infection. Well, if you suspect that you might have measles, the chances are that it's not going to be measles. But if you've had contact with anyone that is known to have measles, or if you've traveled to an area where there's community spread, such as what is happening in Williams County, and you develop, suspicious illness, which includes, fevers, malaise, headache, cough, coryza, or rhinitis, and conjunctivitis, and followed by rash. You don't have to have all the symptoms, but these are some of the things to watch out for. And then you should contact your healthcare provider so that you can get tested, and stay away from exposing other people to it if you seriously suspect that you may have this measles, and have this exposure that I've described above. There's no, just to reassure the public that there's no reason to panic. And like I said, the major thing to do is to, avail yourself of the protection that we know works and that is available. There are so many other Illnesses, that we can worry about, but this is one disease that we know that we can prevent, and we have the, we have the resources to be able to prevent it from spreading and causing panic in the community.